Hi, I'm Robert Shanks from Spine Plus Clinics. In terms of what a disc looks like inside the body, this model illustrates really what a healthy disc looks like. The discs are structural orbs that sit between the vertebral bones here, okay? And within the disc, there's a central part that's really made of fluid, gives it the cushioning and shock absorption qualities it needs, and then outer layers of cartilage. So I said that's a normal version, and this one here illustrates really what happens when discs start to get damaged and become injured. So this here we can see that the central part now is starting to become red, it's becoming a little bit worn, starting to bulge a little bit as well here, just like the beginnings of something bulging here. This probably though wouldn't cause too many symptoms because there's no real nerves in the internal part of the disc here. So this is where problems might be accumulating that patients aren't aware of. Take that on a stage, and then you can see here how the disc is a little bit thinner than it perhaps once was. Those discs there and there, so it's a thinner disc. The thinness of the disc will probably then be putting some more pressure on the joints at the back, the facet joints, so they're going to be more approximated. So that might cause some localised pain in the back. But then this little part here, this red bit here, this is really what a slip disc looks like, or a bulging disc, herniated disc. They're all the same names really, and mean the same thing. But you can see how this is then pressing on that nerve next to that disc, and the nerve should really be looking like that, but here we can see it's inflamed and swollen and thickened, and that would without question be giving that patient some quite bad sciatic pain if that was to be happening with them. In terms of what we then can do for this, really worst case scenario, if it's really, really bad, then sometimes the only option is surgery, and the surgeon has to then chop out either the portion, this bulging portion of the disc, or even sometimes if it's a fusion, take out the whole disc itself, either perform a disc replacement or even a fusion operation where they fuse the two bones together. However, there are some stages in between, and it's not as drastic as having to have surgery. And one of the things we have in the clinic here, what we've had recently, or the new thing we've had, is the IDD spinal decompression machine. Now really that's trying to be a bridge gap between the physical therapy and the surgery. So sometimes a patient like this, they've got this sort of thing going on here. It's not uncommon for them not to get on too well with the manual therapy side of things, and the physical therapy, and even the exercises. In our experience, and and lots of other clinics will say the same, it's sometimes quite difficult to do too much of these discs like this. But the IDD really, what that does, it's trying to take some pressure off the disc. The patient will be lying down, and the offending disc would be targeted, and it takes some pressure, draws that vertebra apart, takes some pressure off that disc, which instantly takes some pressure off some of the pain-causing structures in the spine, and also opens up the space where that nerve is, which will help to take some pressure off, to get some circulation back around that nerve, reduce some swelling, and get the segment starting to move a bit better. The other thing it will do is help the circulation to the disc, and if you can help that circulation to the disc, it's then got an improved chance of repairing and healing, and hopefully avoiding surgery. In terms of the results, we're seeing some really good results in our clinic here. It doesn't work for every single patient, but the vast majority of patients with a disc-related injury are finding some real benefits, and without question we've had some patients who previously we've tried everything with them, hadn't helped. We've then tried the IDD therapy, and lo and behold, they're going on really, really well.